When I originally wanted to be a plastic surgeon, there was this stigma. It was an old lady who was 50 years old, going through a divorce, looked old and tired, wanted to be pulled, and then everybody sort of viewed her as, oh, she's now addicted to plastic surgery. She's getting too much, and that was the stigma of plastic surgery, and it was almost secretive, and you went through the back entrance at your plastic surgeon's office, you had your procedure, and then you snuck out.
I read this statistic, and it says that in the United States alone, there were approximately 26.2 million surgical and minimally invasive cosmetic and reconstructive procedures performed in 2022. 26.2 million.
Yes.
And that was up 19% from 2019. So just a few years before.
Yes.
Now, 2 years later, I bet it's even higher than that.
Buccal fat pad removal is something that's going to shift. I really believe that we're going to realize when these people who are having buccal fat removed now, when they're 50 or 60 years old and they look hollow in the cheeks and their faces are dropping because there's nothing supporting the fat above it, it's to me much more restorative to add fat.
So how has beauty trends shifted over the last, let's say, decade or a few decades?
In plastic surgery in particular, beauty trends come and go. These trends where you get one thing that's very, very popular and then something else sort of takes over and then you shift back. I think for me, what I've noticed though, is that it's not so much about the modalities that are changing in plastic surgery, but how we define our relationship with plastic surgery right now. So I'm a huge proponent of plastic surgery is the last thing you should do to achieve a more youthful look.
Really?
Right?
Okay, so let's dispel some myths.
You better choose it. Ever since I wrote my goals down with the pen, my dreams and reality have both been blending in. I just hope that in the end.
Okay. See, I was nervous in the OR with you.
Well, that's nothing. That's such a safe space. That's like the safest. That's my calm, happy place.
It's so funny. I remember saying I was nervous about the anesthesia, and you're like, "That's the easiest part."
Oh, that's the best part. That's the best part. You feel so well rested afterwards. I'm just zen. I was like, just enjoy this. You have 2 hours to enjoy
true. That's
this.
Nice. Yeah.
And you wake up from it, you feel rested.
So, Dr. Kriya.
Yes.
Give me a little overview of your academic journey, and then as your career now as a Beverly Hills plastic surgeon.
Sure. So it is a very long journey to do facial plastic surgery. So I was born in South Africa, but even then I was like, I want to be a plastic surgeon, So
really?
From when I was 9 years old, I was like, I'm going to do plastic surgery. I think I watched a documentary on cleft lip and palate, and I was like, that's what I'm going to do.
Did you ever do that?
And
the cleft lip?
I did. During my training, I went a couple of times to Haiti, and I did those those mission trips where we do that, and I still do that. I do that every Monday. I do cleft lip and palate.
Every Monday?
Every Monday. I do cleft lip and palate for kids, yeah.
Do they find you, or is it part of an organization?
No. So it's part of an organization. It's the Cleft and Craniofacial Foundation, and it's affiliated with UCLA, and every Monday it's a lot of underserved kids in the LA area. A lot of them are coming from Bakersfield and from surrounding areas. They don't otherwise have access to care, and we do cleft lip and palate. So I knew I wanted to do that, and then it sort of evolved. I wanted to do that, and then I was an artist. I wanted to do sculptural stuff, and I was like, okay, the face is where I want to focus, and I want to do, because that's, to me, where you're interacting with the world. Your face is how you present yourself to the world. It's the first thing somebody sees. So that was my focus. So after my residency and my medical training in Miami, I came to UCLA, and I did a craniofacial fellowship. And that's where I really got into facial feminization and facial cosmetics and reconstruction. And I actually learned the techniques of cleft palate reconstruction and cleft lip reconstruction. And then that's sort of how I ended in Beverly Hills, just because I stayed in LA area to be part of that UCLA program with cleft lip and palate. And I wanted to focus on the face. It's always just been the area that I like to operate. It's really fine surgeries, but it's also, again, your emotional interaction with the world. So to me, that was the obvious path.
And we'll get into what I did with you too. But before that, I want to say that's why it's so important to go to somebody too who like you were in, I didn't know you did sculpting. So that means you really care about fine detail, and it's not like you're, I do breast, but I will do somebody's nose. No, you focus on the face.
Yeah, absolutely. I think for plastic surgery, for any surgery, it's really important to go to somebody whose focus is that area. You can't be as a surgeon, my belief is you can't be good at everything, right? It's nice to do other surgeries, and like I'll do the easier surgeries that like lipo-sculpting, I'll do that too. And I'll do breast augmentation if I have a patient who really wants it. But for me, my focus is the face because it's so sculptural.
Wow.
And it's always been about noses for me. I've always been somebody who's focused on the nose and the eyes, and that's the area. And I like to do some lips too. I really like all the bony stuff and then the soft tissue over it. So like you said, it's very detail oriented. And for me, it was just, I need to focus on one area.
So how has like beauty trends shifted over the last, let's say, decade or few decades? What are we seeing that used to be really popular that now we're moving away from, or the other way around?
So that's such an interesting question to me, because I think in plastic surgery in particular, beauty trends come and go, and it's very cyclical. And you get, like, for example, years ago, everybody was about ablative laser treatments. And then it was, no, that's too damaging to the skin. Let's go to non-ablative laser treatments. And now we're shifting back because technology changes and grows. So now we have lasers that are safer, so they can be stronger, they can be deeper. But there is this sort of pendulum that shifts back and forth in plastic surgery, in medicine in general. You get these trends where you get one thing that's very, very popular, and then something else sort of takes over, and then you shift back. I think for me, what I've noticed though, is that it's not so much about the modalities that are changing in plastic surgery, but how we define our relationship with plastic surgery right now. I think that has been the biggest change in the beauty industry, in the plastic surgery industry, in the self-care industry, because, you know, when I originally wanted to be a plastic surgeon, there was this stigma. It was an old lady who was 50 years old, going through a divorce, looked old and tired, wanted to be pulled, and then everybody sort of viewed her as, oh, she's now addicted to plastic surgery. She's getting too much, and you know, she lunches with her friends, and she's had too much plastic surgery. And that was the stigma of plastic surgery, and it was almost secretive, and you went through the back entrance at your plastic surgeon's office, you had your procedure, and then you snuck out. And I think that the biggest trend now is owning it. And I see a lot of younger patients who come in and they have a very different relationship with plastic surgery. It's like, yeah, I'm doing this for me. And I'm doing this to augment my securities rather than to sort of treat my insecurities. And I think that that's where I'm seeing a shift. It's like this consciousness shift that's happening. I'm getting a lot of younger patients who are using plastic surgery and all these different modalities in combination to prevent aging, to feel really good about themselves, like stem cell therapy, fat grafting therapy, radiofrequency. All of this is being used together now. And I think that is really where we're seeing a shift in the beauty industry.
Right now, all around me, there are the frequencies of abundance and inner peace. You can have that and more. So take a second and let me tell you about Quantum Upgrade. Let's talk about like the Quantum Upgrade dashboard so people can see sort of how it works.
We use a very complicated, sophisticated system, which is, as far as we know, the most powerful source out there for quantum energy on Earth. You can pick from like, I think 26, 28 different frequencies now that we have. Inner peace, which you could leverage at night, for example. A lot of people do that. We have the Olympic performance. We have even something like weight management. We have the abundance prosperity. The service actually starts. Like within 5 minutes, the energy, you will notice it starts ramping up. In the dashboard, you can select the Hawkins level for the day and pick between a level from 500 to I think like 1,200 or something like that. Just start low, you know, go on 600 because it's not about faster, stronger, more powerful. Best is what feels good to you.
Like men's booster, women's booster, inflammation support, testosterone booster.
It's activating that testosterone actually can increase again. And 5 of these studies, and it showed in 46% to 100% acceleration in wound healing. But we do have a free trial that we want to offer all your listeners. So code Frankly, you get a 15-day free trial.
It's interesting what you say about like the women who used to like hide, go through the back door, but now they're owning it. Because I read this statistic and it says that in the United States alone, there were approximately 26.2 million surgical and minimally invasive cosmetic and reconstructive procedures performed in 2022. 26.2 million.
Yes.
And that was up 19% from 2019. So just a few years before.
Yes.
So now, 2 years later, I bet it's even higher than that.
Yeah, and people are a lot more comfortable, and we're seeing a shift to younger patients. And I think a lot of it has to do with social media, right? People are posting their before and afters. They're talking about their surgeries. They're much more open about it. And so it makes people more comfortable. It allows people to seek care, to talk to multiple plastic surgeons, to find the right surgeon, because there is an open conversation. Because I'm okay with doing this for myself. I want to present myself to the world in a certain way, and I'm going to own that. And so I'm going to get what procedures I need in order to be there, in order to feel that confidence and to sort of create my appearance and my persona. And I think there's just a much more holistic approach to plastic surgery that's happened. It's a lot about like, this is for myself, for my mind, for my body, for my spirit. It's a much more well-rounded experience for patients. So it doesn't need to be that sort of backdoor experience that it used to be. It can be much more in the open and a part of the conversation. And it's with the idea or the sort of the confidence behind it that like, I'm doing this for me and I'm owning that. And I think that shift is really powerful, and it helps to create a really good dynamic with your surgeon.
And then because you're in Beverly Hills, but like not only Beverly Hills, Rodeo Drive.
Yeah.
Do you feel like you see that stereotype of like the women who have gone too far, or maybe, it becomes a competitive thing?
Always in plastic surgery, there's going to be for anything, there's going to be that group of people that goes too far, right? Mm-hmm. As a surgeon, I think it's my responsibility to say, okay, I draw the line here. Like, I'm not doing this to you. You've had too much. This isn't going to help you. Because when people start to use surgery as a crutch to try treat the emotional, the psychological traumas, it's not going to work. They're never happy with the outcome. That's why they keep getting more and more and more, because there's something much deeper that needs to be healed. And surgery is just not the response.
That's when they come with me to do ayahuasca.
Exactly. You need a different kind of healing for that. And that's why I like multiple modalities of healing. And plastic surgery can absolutely be part of a healing journey. And so to me, it was always like, people say, oh, plastic surgery, you're a doctor who does this, but it's not actually curing anything. And it does. There are emotional and psychiatric and spiritual aspects to plastic surgery and to feeling good about yourself that are very curative. But there's a line. As the plastic surgeon, I have to say, okay, this is not going to help anymore. This needs a different kind of work. You need to approach that from a different, because you do see those patients, especially in an area like Beverly Hills, who have had too much, gone too far, and I don't want to be the person who adds to that.
Because it's just so easy, right? If they have the access and they have the resources, it's like, it's such a test of your own like will to be like, okay, I don't need to do this much.
Oh, yeah.
And we've seen like with people like Courtney Cox, for example, I mean, there's so many, but she was open about it. So I think that's why I can bring her up. And she says like, I looked in the mirror one day and realized like, oh my God, like I didn't realize how far I had gone, and I didn't even realize that was me, right? Yeah. And so she said all her filler removed. Yeah. And it's like interesting because you kind of like build this standard of a new normal. So you forget what you were like, and right, and you just keep building on it. And you don't realize. And that's why I never wanted to do filler. And that's why I came to you, which we'll talk about, is because I was like, I just don't want to go down that line. But I also didn't want to put like fake things in my body. I've done biostimulators before. I've done things that stimulate my own collagen, but I've never had like actual filler. Yeah. And so I came to you. We took fat out from... You joke, you're like the 1% fat you had. It's 5%, thank you.
You had like nothing. You had 2 cells.
But we took that little, 2 cells and put them just in different parts of the face to kind of just, wherever normal fat loss would have happened, just to like rebuild that, right? Yeah. And for me, I guess this is going to be a 2-part question, but we can talk about what I did first if you want. And then I want to talk about some of these trends that people are doing. Like, removing that fat from their face, which I feel like ages people.
Yes,
but,
absolutely. Yeah. I think So talking about what you did, the fat grafting, that is becoming extremely popular. I think it was something around like 500,000 facial fat grafting cases in the world annually is the current statistic. So it's a lot. And then when you're looking at other fat transfer procedures like to the breasts and the buttock, it's a very popular modality right now. That's sort of one of the trends in plastic surgery. But it's actually a trend that I really like because it's natural. You're using your own autologous tissue and you're just putting back fat where fat is repleted, because as we age, we lose fat in an area. And so we're just sort of restoring or putting back what was originally there. We're not putting something there that wasn't originally there. So like you said, you didn't want anything artificial in your face. And the reason I like fat is because you can really blend it. It's like painting. You can absolutely make it blend into your natural anatomic structures, and it's something that is natural, it's soft, it's malleable. So I can work with it in a way that makes it look extremely natural. Again, I have to know as the surgeon, this is too much. I can't overfill. I can't take the risk of putting too much in an area so that you look deformed or distorted afterwards. I'm a surgeon who would rather do it in stages just to get just the right amount. But we do have to remember what you looked like before, what that change is, and how far we actually need to go, because it's very easy to lose track of where we started. When people look in the mirror at themselves, their brain adjusts very quickly to their new appearance. So pretty much immediately, your brain kind of says, this is how I always looked.
That's what happened with me. I was like, wait, I always look like this. And then I looked at the before after you guys sent, and I was like, oh wait, no, there was more hollowness.
Right. And so that's how people lose track of it. That's how people do fillers. And all of a sudden their whole face is distorted and they don't look anything like their original before photo, because in their brain, the change is subtle because they're doing it over time and they're looking at themselves every day and their brain is making that adjustment. But you have to sort of go back to that original photo and that starting place and say, okay, there actually has been a significant change and I need to stop. It's very easy to keep going. It's very hard to stop. And as a plastic surgeon, I need to understand that subtlety and where that line is, that I need to say to a patient, okay, this is where we stop, or we're going to start to distort your anatomy.
Yeah, because you wanted to see my photos from like 10 years ago.
Right.
Yeah.
It's not a change to yesterday. Like, I need to go all the way back and I need to see what you looked like when you had all that fat in your face. I want to get back as close as I can to that. I don't want to go further than that, because that was never your normal anatomy. And you can distort anatomy with fat, you can distort anatomy with fillers. It's really, really important to be subtle about it and to do it in a skillful, very natural way. You can make fillers look natural too. I personally don't like them as much, just because, like you said, it's an artificial substance. It is usually hyaluronic acid, which is something that is in your body. That's a substance that's found in your joints. And when you put it in the skin, it attracts water to that area. And it can look a little bit puffy, and it's a little bit firmer than fat. It's harder for me to mold and to blend. And so I can put that in and it can have similar results, but it's not as natural, as soft, and it doesn't last as long. So I prefer to work with fat because that's what was there naturally. Yeah,
and I didn't know you can actually make it malleable too.
Oh yeah, so we really, really refine it. Without damaging the fat cells, we get it into as pure a form as possible. And it's quite thin as you inject it. And so I'm just really, every little micro injection, placing it where I want it so that it blends into the surrounding tissue, because we don't want just a lump of fat in an area.
Okay, so let's dispel some myths.
Yes, sure.
Hey, I just really quickly want to tell you about the necklace that I'm wearing. You might see me wearing it in a lot of these episodes. I actually give it to many of the guests too. They're from LEELA Quantum Technology, and as you can see, there are little capsules inside that are supercharged with what they call quantum energy. And it's just like walking around with one of the full-sized infinity blocks with you wherever you go. So you can get those on the website too and be quantumly upgraded wherever you go. What about like trends, like for example, the buccal fat removal, which we talked about off camera too. I have a friend who she was like she's not anymore, but she was a model, and she was like in New York and Malaysia and all these places. And she, because she's Asian and Spanish, she has these big cheekbones, and they wanted her to take her buccal fat out. She was like 17 years old. Oh, God. I know. And she said, thankfully, she said no back then. She's like, I don't want to do that. And now she's like, Frank, I'm so glad because now I love my cheeks. It's what makes me look young at 35, you know?
Exactly.
And she has these big round cheeks. So yeah, do you think it's like bad overall or just for some people?
Okay, there's always a place for it, right? If I have a person who's really heavy, thick chipmunk cheeks, sure, and sort of a weaker cheekbone, sure, that one person may need it. But I am really not a big fan of buccal fat pad removal. You know, it's a deeper fat pad in the face. I believe it gives some structural support to the face. And like you said, the one thing we're losing as we age is structural support and fat. And to take that fat pad out of the face is inherently an aging procedure. So why would we do that, right? To me, I rather use fat from another area and build up the cheekbones if we want a little bit more fullness in the cheekbones, because that adds support, adds fat, rather than subtracting. And that is actually a trend that we've seen in plastic surgery. We've sort of learned that subtracting is not great. When we used to do rhinoplasties, we used to use a subtractive method. We used to take as much collagen as possible, and everybody ended with these like little tiny pointy noses that basically were like little ski slopes. They had no support. They weren't natural looking. We have completely shifted in rhinoplasty to let's add collagen support and let's add structural support there with more collagen and build up the framework of the nose rather than subtract it.
Oh, really?
So
You're adding.
Yeah, so we use cartilage grafts now versus in the past we would completely subtract cartilage from the nose. And so we are seeing those trends. And I think buccal fat pad removal is something that's going to shift. I really believe that we're going to realize when these people who are having buccal fat removed now, when they're 50 or 60 years old and they look hollow in the cheeks and their faces are dropping because there's nothing supporting the fat above it, we're going to say, oh, we shouldn't have taken that fat out. It's to me much more restorative to add fat.
I looked up traits that are widely considered youthful.
Yes.
And this is what came up. Skin that is smooth, soft, well hydrated, and rich in cells that regenerate relatively quickly. So it's like what you just described. It is that like fat, the smooth skin, the collagen, like keeping that in, the rich, the moisture.
Right. And sometimes, you know, when you see people who are, and not that I'm condoning obesity in any way, it's unhealthy and not good for you. But, you know, when you see those people, a lot of heavier set people will have a really smooth, round face. And it's because they have all the fat in their face. So when people started talking about Ozempic face after all these diet pills and injections started, all that's happening is you're losing fat in the face. It's not that the medication's doing anything to your face. You're just losing the fat that you had there, and you're losing all the structural support. And
to me, it looks so bad. I don't want to like, you know, be mean or anything, but it looks so bad. Yeah. And I saw somebody recently who, it was a TV show. I haven't watched like a reality show or anything like that in years. And I was like cooking the other day and I just wanted something on in the background, and I put it on, and there was a guy in the show, I won't like say who, and the whole family was like talking about how good he looks now and he looks so much healthier. And to me, it's clear that he probably did something like Ozempic, right? Like that's what it looks like to me. And it did not look good. He looked gaunt. He looked like a skeleton, like Skeletor, like the character.
We need fat. We need fat. It's a part of our structural framework. We need it. It supports other tissues. It supports our skin. Obviously, we need to be in a healthy weight range, but we need that tissue in our body. So yeah, any extreme is not good. Being too thin is not good. Being overweight is not good. But if we're able to find that balance and then use surgical procedures like fat grafting to restore what we lose with age, I think that that's probably the best way to go in terms of sort of holding on to as much youth as we can.
So I kind of feel like we brushed over my thing too, but and I will say I'll show before and after photos, so they'll be like put up right now, and that'll show like, so people can get an idea where, I mean, I was totally fine with how it looked before, but I'm so much happier, like just seeing the little subtle fullness. Yeah, you know? It's
just, I think that's the key to any facial surgery is subtlety. It needs to be natural and subtle. And so like for you, I think for me, when I'm looking at you now, the immediate area as I walked in the door, because I haven't seen you in a while, it was like, wow, his temples really took. The fat there really took because you had a little bit of fat atrophy right here. And to me, I'm like, wow, it changed the shape of his face. Like all of this filled out.
And that's never a place that I would have thought. I just remember saying to you like, hey, if we're gonna have this extra fat anyway, like you don't use it, just go ahead and put it in the temple.
Yeah.
And it ended up being the thing you noticed the most.
Oh yeah, I like really restructured your face. I think I noticed it there the most, and a little bit in your cheekbone here, a little bit.
Which is really what did we do? We did temples, a little under the cheekbone or under the eyes.
Under the eye, we filled
and
this
then a little of the folds.
and a little of the folds. The folds is an area that I'm very, very sensitive with because people look alien if you completely eliminate
If you don't
that.
have any lines.
Yeah, you
But I
need
have
that
very
fold.
strong lines.
You had very strong lines,
Yeah.
and now they're very subtle. Now they just look young and natural.
Are they subtle now?
Yeah,
Okay,
you
'cause
have
I still
a
feel like
very,
they're big, but yeah.
you have a very subtle line now. Like when you're
Okay.
at rest, I don't really see much of them. They were quite deep before.
Yeah.
But you want certain like anatomic landmarks
That's
to
not like
still
Botox.
exist.
Like I don't get it because I still want to I want when I smile for the lines to be there. I want,
that expression.
I like it.
Yeah.
I like it.
It's how we interact with each
Yeah,
other. We
and I'm
need
not
that
against it. I think
expression,
people look great sometimes when they get it
Yeah.
too. I just personally like it. I like how I look without it.
Yeah.
Yeah.
I think it's such a personal, all of this is such a personal experience and interaction. And you have to find a plastic surgeon who you can sort of exchange an energy with in a way that you understand each other and that you can have a vision and work with them and be open to working with them. And to me, it's always this. It's not one surgery. It's a relationship and a procedure, and it's something that lasts. And it's like you would go to your primary care doctor.
You stick with that person. They know you. They know your procedures.
And they know like where you want to go, what you need, how many times are we going to do this? Because like I've told you before, fat grafting works really well in stages, and that's the way to keep it looking natural. Is like do it once, and then 2-3 years down the line.
Oh yeah, because we should talk about that. It's basically technically permanent, right?
Yeah, so I'm transferring. What happens is I take those fat cells from that area that we took them, so in the flanks, in the belly, in the inner thigh, wherever I'm going to take them from, and I put them into the face, and they're basically like little storage containers that I'm taking from one area, moving to another area. So as your weight fluctuates, depending on how big or small you are, they'll be either full or empty.
Wow. So if I gained weight, it would gain in my face.
You would gain a little bit more in your face than you used to gain, and you would gain a little bit less in the flanks. Not that you had very much, not that you had very much to gain, but that we're transferring the location of those containers, and technically whatever cells remain viable and are living there will stay there. But as you age, fat goes away. So as you age, some of those cells will atrophy and die, and then you may need another fat grafting procedure 5-6 years down the line if you start to notice those little areas coming back. But it is much more long lasting and permanent than a filler. And that's why I like it, because it's not creating all this scar tissue. And it's not a 6-month sort of procedure that we need to keep repeating and keep recreating scar tissue and inflammation in the face. And, and that's what fillers do. Yeah. And it's very hard to control that. The fat doesn't do that.
Yeah, and I like that you told me to get, and I had already had it booked, but hyperbaric chamber after. So it's kind of good for people to know who are watching, like the reason you said that is because it helps for those fat cells that you injected to not die, like to stay alive. So it's probably good for anyone to do anyway, right?
So I am the biggest proponent. If you are cleared, if you're medically cleared, there are certain people who can't get hyperbarics, right? If you are somebody who actively has cancer, you should not get hyperbarics. But for everybody else, I'm a huge proponent of hyperbarics. It has been shown to increase your lifespan. And for surgical patients, I love it because it creates healing about 75% quicker than if it's a huge, huge difference. People feel a lot better, a lot faster with hyperbarics. So it's not just beneficial for the fat grafting sites, but it's also beneficial for the donor sites because those areas are healing. You're getting a lot of oxygen, and basically what you're doing, normally our room air is 21% oxygen. You're getting 100% pressurized oxygen in this chamber, and you're really loading up your blood cells with oxygen, and then it's being carried to these surgical sites and offloaded, and you're getting this really rich oxygen environment for the fat cells. And if you think about it, I'm like detaching the fat cells from where they've lived their whole life. I'm uprooting them, putting them in a new area after I've processed them outside of your body in a canister. They're traumatized.
Wow.
And they are not connected to any blood vessels, and they really have no real way of getting oxygen aside from just the diffusion of oxygen around them. So if you can load your blood with oxygen to feed those cells while they settle in and reroute and get that new blood supply, you're giving that fat a longer period of time with oxygen, and you're allowing those fat cells to survive.
Yeah, and luckily, actually, I had gone and gotten ozone therapy the day before surgery too.
Yeah.
So already my blood had oxygen.
Yeah, you want to oxygenate. It's super important for any kind of healing, whether fat grafting or not, but particularly for fat grafting, it really does increase the take. When I do some body fat grafting, which I do some of, the BBLs and the breast fat grafting, I have noticed about a 20% increase of normal graft survival. So if patients are losing about 40% in those areas of fat, now they're only losing about 20%. And in the face, the face really varies, and the face is already an oxygen-rich environment because you have such good blood flow to your face. So you tend to keep more of the fat in your face. You tend to keep about 70% of the fat that we graft. But if you can increase it to 80%, 85%, why not? And it makes you feel better at the same time.
Yeah, exactly. So let's talk about some of the things people can do to achieve a more youthful look. Hey, did you know that you're walking around like a radio tower, just broadcasting out these messages and frequencies on a subconscious level? And some of those broadcasts are negative, and they could be affecting the way people see you, the way people treat you. Did you also know that you're never upset for the reason that you think you're upset? We're also walking around with these trapped emotions, trapped old traumas from things that have happened to us in our past. And that's what I clear for people when they come and work with me one-on-one. We look for the subconscious blocks that are affecting you, and I clear them. Most people report the next day, if not that same day, they feel lighter, they feel happier, they feel free. And a lot of times you can check out the testimonials on my website to see people resolve physical illnesses and physical traumas like restless leg syndrome, eye pressure problems, cold feet, cold hands, anxiety. All of these things are things that I've seen get cleared when people work with me. It's all done on an energetic level. And the best part is that it's done remotely from the comfort of your home. We just get on a Zoom call, and in 30 minutes, you can experience what feels like 10 years of therapy. So if you're curious, go to www.frankelaridi.com, and I cannot wait to work with you.
Okay, so I'm a huge proponent of plastic surgery is the last thing you should do to achieve a more youthful look, right?
Really?
You should, it starts young. It starts with skincare. It starts with not going in the sun and burning your skin or laying in a tanning bed. It starts with diet and exercise and really being healthy. And then we can get to, you know, the topical modalities, the radio frequencies, the lasers, the skincare, vitamin C serum, and hyaluronic acid topicals, and all of those things can help. They help a little bit though. They don't give you the surgical result. And then the last thing is fat grafting, and then ultimately something like a facelift in order to sort of alleviate the stressors or the signs of aging. But it really starts early, and it starts with all those other modalities first. And surgery should never be used, I think, as its own sort of standalone thing. Even if you get to the place where you need a facelift, you need to still be doing all of those other things. You need to support it with the nutrition. You need to support it with the oxygen therapy. You need to support it with the radio frequency. For me right now, the thing that I like the most, and I might be just sort of following the trends, is I really am seeing great results with radio frequency microneedling. It's the Morpheus treatments. And if you go to a microneedling tech who applies some radio frequency, it creates some skin tightening. It is stimulating the collagen, and that's really helping to prevent the aging, because it gives the skin that sort of, like you were saying, that softness, the glow, the tightness. So you're seeing all of that with radio frequencies and microneedling, but it's never going to give you the surgical result. I think they just came out with a study that said, you know, radio frequency microneedling gives you 30% of the tightening that a facelift, 37% of the tightening of a facelift. So you're getting a good
But
amount.
still, then a facelift must look amazing, because I'll tell you, like the woman that does my ozone, the nurse, I saw her and I was like, what did you do? Like I saw you 2 weeks ago. Like, what did you do? And because she just looked so much tighter. I mean, she looked like a different person. And she's like in her like 50s, has 2 kids, all these things, right? And she was like, oh, this thing called the scarlet laser. It's radio frequency and, you know, microneedling. And she looked like she had gotten, not a facelift, like you said, but I mean, a different person.
It's tightening.
But even the quality of her skin.
Yes.
And she was like, it felt like a saran wrap, just like around her face.
It hurts a little, I can't lie. It
she told me that too,
It's a little tender. It kind of stings as it's happening, but it's very short-lived, that pain. It feels like you've had a sunburn afterwards for a couple of hours, and then it goes away. Depending on where they do it, how they do it, what kind of topical anesthesia you get, you know, it's more or less tolerable. But those treatments really do work. There is a space for all of that.
So like do all that until like you're at a certain age or time where you need more.
Yeah, like I never say I shouldn't say never. There are people who need facelifts in their 30s, but for the most part, you should try to prolong that, and you should try to do all of these other things and really take care of your skin and your tissues until that time where it's like, okay, the only thing that's going to work is a facelift. And you know, it's funny because I'll get the patients who really need a facelift coming into my office and they'll say, oh, I want fillers. I just want fillers. I don't want any. And I'm like, I can't get you that result. You want the big result, but you don't want the big step to get there. So you have to really understand and work with your surgeon and saying, what will get me to where I want to be? Because I can fill your face with fillers, but you're just going to look like morphed into something that you're not, right? Yeah. You're not going to look natural. I can do it, sure, but it's not the right move. The right move is at some point taking skin away. And that's when you get to the surgery. But, you know, I'll also get that other extreme of somebody who comes in and they're 25 and want a facelift. And I'm like, okay, we're not there yet. We just need to maybe do some like topicals and some radio frequencies to maintain. So it's just really about working with your surgeon to find what's right.
And then are they glad that they didn't do it after they see the results from something like a laser?
Yeah, I think for the most part, people just need education, and they need to know what's available to them. And there's so much, and you go on the internet and you can read so much. There are a million types of lasers and a million types of fillers, and every other nurse is injecting. And you know, it's you have to do your research. You have to be really careful. You want to find somebody who's done the appropriate training for what you're asking for, right? Like, it's not appropriate if somebody has done a weekend course in fillers and they're now injecting your face. That's not appropriate training when a plastic surgeon takes 7 years of education and residency to do the same procedure. Like, that shouldn't be equal. You really need to find who's doing it, how long they've been doing it. You need to see the before and afters and like understand that, okay, this person's had the education necessary to do this to my face.
You're actually the one doing the laser?
So no, I don't do the laser in my office. We have a nurse practitioner who's done it for 20 years and she knows how to do those lasers and adjust the settings, and she's worked with those machines for a long time. So she's the person doing the lasers. And I'm a huge believer that like the person who's most qualified should be doing that. For me, I do the facial surgeries and the fat grafting. And I can obviously do fillers. I trained in it for a long time. But I really think it's important when people are out there looking on the internet, sifting through all this information, that they find the person who's not going to just say, okay, yeah, this is what I sell, so this is what you get. Exactly. It's not the place to save money. It's
for
not.
For sure. So I guess this will be sort of one of the last things is because you mentioned start young. And I like that because, you know, when I was little, you would just like burn your face with like Neutrogena or whatever, like pimple cream, and you know, like all these things we didn't know. We'd use like this abrasive, horrible soaps and things like that. Yeah. And now I'm seeing these like kids, and they're like on TikTok and things, and they have like a 12-step Korean skincare routine with like, and it's kind of cool that like social media has done that. I mean, it can be too far, obviously, but yeah, it's like pretty cool that they care about the right sunscreen, the right ingredients and things like that. And they're thinking about it at a young age. We never wore sunscreen. I was at the beach. We'd be putting oil on ourselves.
That's what I did in a tanning bed. And I just wish I could.
I worked at a tanning salon.
I'd go weekly in Florida in the sun.
Yeah.
But That's what I'm saying. That's what I said to you. Like, it's really not so much about modalities shifting in plastic surgery now and like what's the trendiest new laser, the trendiest new treatment, because I think people have started to realize there's just so much that like not one of them is better than the other. It's really the hands of the surgeon that you're in and how they use it and what their technique is and working with them. That's what's important. But really it's this shift to like, I'm going to do this as a younger person and I'm going to own this and I'm going to start early and start young. And like people now who are doing Botox and these toxins are needing facelifts a lot later on because they're paralyzing the muscle that creates the wrinkles at an early age. And so it creates a little bit of atrophy. It weakens the muscle over time and they're prolonging that journey to a facelift. If
they had done what?
Botox. So if you do some Botox in those areas, for some people, like I have really strong lines. I haven't done any toxin recently, but you can see I have really strong muscles in my forehead. The more I paralyze those muscles, the less active they are, the less they make those deep furrows and wrinkles in my forehead. Those muscles atrophy with the toxin, and then I don't need a facelift or a brow lift for many more years.
Really?
Yeah. So, but you have to be careful because at the same time, you want balance. You don't want to look frozen. You don't want to be interacting with the world in like this expressionless manner, because that's when we start to veer off into, oh, this person had too much plastic surgery, this person's addicted, and then we get into that stigmatized area of plastic surgery.
I've noticed a lot of plastic surgeons, like you look at them on TV or on things and they look like they've had nothing done. And I'm like, that's interesting. That should tell you something.
Yeah, you want to do it in a gentle, sort of balanced way. You don't want to look like you've had too much done.
Yeah.
But
some of them look like they do nothing. Like that's my point.
And
like,
some do. Some do nothing.
Yeah.
Some do nothing. I think most of us probably do a little Botox
here
and there, a little Botox, a little fillers, a little fat transfer here and there, but very sort of mild in our
because you've probably seen how far it can go.
Yeah, we don't, and we have access to it, so it's we have to really be careful, right? Like it would be easy for me to keep getting surgeries. I've had surgeries. I've had 2 rhinoplasties, and I've definitely done a significant amount of Botox.
I saw it on your social. That was pretty cool. You showed like the journey. You were like day 4, and your nose was taped up. Yeah,
I showed it all. I wanted to sort of share that with people so that they have a realistic expectation of this is what surgery looks like. You don't come in and walk out the same day as if nothing's happened. That surgery is a trauma to the body, but it can be done well and it can be done in a way that lets you heal really well. And I'm super happy I did it. I would do it again 100 times.
Wow, yeah. I mean, I would definitely come to you for anything because you really built, like you said, like that relationship. You really don't go overboard. You want to talk to the person, figure out, is this really what you want? Am I the one to do it? Yeah, it's really good. So how can people find you?
They can go on my website, which is drkriya.com, or they can call our office, and I can give you our office phone number. We'll put it in the
description.
Can call our office and set up an appointment, and then we do either virtual consultations or in-person consultations. But to me, the single most important part of plastic surgery is the rapport I have with a patient and that relationship, because I have a vision in my head, and as an artist and a sculptor, I have that, but that's not nearly enough. I have to have the same vision as the patient. We have to make sure our aesthetic is in alignment, and like I said to you, it's an energy exchange between a physician and a patient in any kind of medicine, but especially in plastic surgery where we're like altering our appearance and our interaction with the world. And so I have to make sure that is right on. Otherwise, that can be really traumatic for a patient. And that no matter how great the result is, they're not going to be happy.
If it doesn't match what they thought it would be.
What they thought, and if the energy of just the exchange between myself and the patient is off, and we're not communicating well, and we're not in alignment of what can be done, what should be done, and we're not understanding each other, that completely alters the whole experience of a surgical procedure, a topical procedure, a laser procedure, whatever. It doesn't matter how invasive or non-invasive it is. You have to be able to work with your provider to really be in alignment and make sure you're understanding what you both are envisioning.
Do you think that, just to piggyback off that, do a lot of people come in from other states to see you?
Yeah. Oh, I've had people from all over the place. I've had patients from Ghana. I've had patients from New Jersey, the East Coast, Texas, Midwest, like everywhere. You get patients, and I think that's a great part of plastic surgery is you can sort of, and especially now with social media, people go on social media. I'm not a huge poster on social media just because.
Yeah, you're really not.
As you know, it's hard for me to get into it.
Yeah,
but
I
I like the interpersonal, like the relationship with somebody.
Yeah.
So I just really don't focus on that. I know I need to, but it's nice in today's world that people can sort of go online and look at the results and get a feel for their plastic surgeon and then decide to travel to them. It's not like a primary care doctor that you need to be in the same place. It's nice if you are. It makes the follow-up a lot easier, but there are ways to do it where you can see your plastic surgeon on the other side of the world.
Yeah. Do you you work with somebody who's really like famous in surgery, right? Who's your
so Michael
officer?
Zarabi is
That's right.
I'm part of Zarabi Plastic Surgery, and I do a lot of the face stuff. And he is a body expert. He does a lot of breast surgery, mommy makeovers, and he is an absolute expert.
What made him like sort of a bigger name? Was there like certain celebrities that?
I honestly don't know.
Because the reason I say that is I was like, I mentioned his name once and everybody was like, oh yeah, he worked on so-and-so, and I can't remember now who they said. But apparently like,
I
it's like
actually
a known
don't
thing.
know that.
Okay.
I actually don't know that.
And I'm sure like half the celebrities he's worked on, you're not allowed to say it, but I'm sure the public
we're not allowed
ones,
to share that, but who's ever said it publicly.
Right.
But, I think that he's just been around for a long time and his work is beautiful. And he does a lot of the body work. He's really an expert in breast and tummy tuck surgery.
Is it just the two of you? So he does body, you do face?
Correct.
Very cool.
That's mostly how it is. And then sort of my face stuff is a lot of aesthetic face, but also reconstructive face stuff, which is the facial feminization surgeries.
Oh yeah,
so I do that.
We should talk about that because that's like a specialty of yours, right?
Yeah, that is my specialty. So when I did the UCLA fellowship, it was very largely focused on facial feminization and gender affirming surgery.
Okay, so that's that. Okay.
Yeah. So it's mostly what I do. I mean, I can do both, where I'm working with patients who are born female and live as males, and I can do that. But most of my patients were born male and they want to live as a female, and they're living as a female, and we're altering their facial structures so that they present as a female, and when they're out in public, they look like a female. And that is a lot more extensive. It's a much bigger surgery than most of the other surgeries I do, because I'm actually changing the bony structure. I'm changing the skull.
Oh, wow.
So we're doing that. But I also do all of those cases, get some facial fat grafting. And so, like I said to you, like I don't want to make you look like a woman because that's not something you wanted,
I remember you saying, because I said,
right?
what about like in my brow, if we have extra, we should just put it in there. And you were like, no, because that would be feminine to have a round.
Yes, right.
Yeah.
And so you have to, whenever you're working with fat, you have to be really, especially when you're working with a male patient, you have to be very cognizant of what changes in the face when you put fat into an area and how that can actually make somebody look less masculine and more feminine. And I do that for the facial feminization patients because they want that. That's how they're comfortable. So I will round out their forehead with a little bit of fat, right? And I'll build up their lips and their cheekbones. When you're doing that in a male patient, you want to restore youth without pushing that boundary so that it becomes a feminine feature.
Right, and that was my whole intention to go to you, was restore youth.
Yes,
like,
right.
Yeah.
Right.
Wow, so fascinating.
It's a very cool industry and field.
Yeah, is there anything you want to leave people with?
I think for me, just the biggest part about plastic surgery and you don't learn this in residency. Like residency is all about the surgical technique and about learning how to take care of people and doing what's safe. And obviously that's super important. But for me, as I've practiced more and more, especially in Beverly Hills, it is the emotional component of plastic surgery. It's something that you need to be really comfortable with and want, and you really need to look at plastic surgery as something that's restorative, and that is, when people go into it and they're a little bit ashamed that they're getting plastic surgery, I don't think the outcome is ever what they want. You have to go into it and own it. And I'm not saying you have to be public with it. Like, sure, I was public with it. You can be very private with it, but you can still own it yourself and say, I'm doing this for me and I'm happy with this and this is what I want and I need for myself. Because I'll have patients come in and the first thing they say to me is, you know, I'm really scared to do this. I don't want anybody to know that I've done anything. You know, I don't know if I should be doing this. And that's not like, that's where you can start having a conversation with your plastic surgeon, but it's not my job to convince you to do it. You need to come to me and say, I want this. Yes, I'm scared. I'm nervous. It's surgery. Will you be there for me? But I want this for me, and I need you to help me get this in a natural way, and this is my goal. And I think that's really important to have that, like, sort of surety.
I believe that you really choose it. Ever since I wrote my goals down with the pen, my dreams and reality have both been blending in. I just hope that in the end, my debt don't extend me all my dividends. If it did, I'd have to keep pivoting. Turn the other cheek and down another dose of adrenaline. I don't need to pretend to live a life that I never did, cause I'm right where I need to be. You can see